Hello, everyone. Welcome to the Your Hearts to Mom podcast. I'm Lauren Rose, and today we're talking about the role of the nervous system in chronic pain. Our guest is Amy Toth, a physical therapist turned chronic pain expert with over 20 years of experience. She's on a mission to help motivated humans who are ready to move out of daily debilitating pain and start enjoying life again. She has taught countless individuals how to recover from chronic pain by regulating and reprogramming their nervous system. Welcome, Amy. Thank you for coming on.
Well, thank you. Thank you very much for having me. It's a pleasure.
Yeah, I think it's going to be an interesting topic, and I think I'm going to learn a lot, so I'm excited.
Yes, it's fascinating science, I have to say.
Yeah, just trying to go too much over my head because I'm a lay person.
That's what I do. I think I do pretty good. I've had a lot
Okay.
of practice.
Okay, awesome. So why don't you tell us a little bit about yourself and then why you transitioned from physical therapy into focusing on chronic pain?
Yes, that's a good question. So my name is Amy. I'm originally from Iowa. I currently live in Minnesota. And I'd known my aunt was a physical therapist. So I had known that I wanted to be a PT since like 7th grade. So then graduated in, this is going to tell you kind of how old I am, graduated in 1999 from PT school, and then moved up to Minnesota to start to practice. And, a few years into it, I was doing good, it seemed to be helping, a decent number of my patients, but there was the group that like seemed to need my help the most, that I seemed to be able to do the least for, which was the people, who are in chronic pain. And it was frustrating. And I refused to accept that there was nothing I could do. Because I just did. I refused. So I started looking a lot into the science behind pain and understanding it. And the challenge with today is our medical system tends to treat chronic pain like it treats, like I call like acute or like regular pain, and they work completely differently. And I just see how much suffering people are in, that and how poorly our current healthcare system can actually help them. And so I just that's kind of the path I have been drawn to, is kind of spreading the word about how it works differently, and trying to give people some hope that it can get better.
I mean, that sounds fantastic that there is hope, because I know I don't get great treatment for my chronic pain. I mean, it's basically let's just manage it as best we can, but we're not going to give you enough medications to fully manage it. We're just going to give you this little bit to kind of get you out of bed, and you can kind of just deal with it after that.
Yeah, and the whole opioid thing has been a disaster. I think if they were used the way they were intended, everything is just fine. But since this whole thing blew up, now everything is going to the opposite end of like, we're not going to give anyone anything unless we absolutely have to. And that's really making a whole lot of people suffer needlessly, in my opinion.
Oh, absolutely.
Yeah, yes. I could go on about that for a while.
Mhm.
As I'm sure
Okay,
you
so
do.
for sure. So let's talk about what you came to talk about, which is the nervous system and what role it has in chronic pain.
Yes. So we'll just start talking about the nervous system a little bit first. So nervous system is your brain, spinal cord, and then all the nerves that come off of it and go, all the way out into, your arms and your legs to your fingers and your toes. And its job is kind of to be like your alarm system. So there's sensors, in your skin and your joints, that you're out in the world. So, the wind blows, the sensors will feel it. They'll send the signals up to your brain. Your brain decides, kind of interprets it, figures out what it wants to do, and then, then sends signals back down to the body to cause it a reaction if it needs to. Like say say like you touched a hot stove, the sensors in your finger that sense temperature would send signals up to your brain. Your brain would be like, that's hot, not good idea, and would send signals back down, and you'd pull your hand away. And then obviously the thing that was causing the issue is gone. So then everything kind of settles back to normal. So that's kind of what I call like normal or acute pain. Normal is probably not the right word for it, but like acute pain, we'll call it acute pain. But when you've had pain for about 6 months, there's no specific like magic number, but the more studies they do, the more like 6 months ish of consistent pain is about when some of these changes start to take place. So then what starts to happen is your body wants to be efficient. And so since it's getting all these extra signals coming in, it's like it decides to just make some changes so it can gather all the information it might possibly need. So on a physiological level, there's various chemicals and things that lower the threshold that the nerves need in order to send a signal. So instead of initially you having to touch like a hot stove for signals to be sent, like you could touch, lukewarm water and like signals would now be sent. So now, number one, it takes less input for your nerve to send signals. So this is why like you maybe used to be able to walk for 45 minutes and now you can only walk for 20, because your nerves are that much more sensitive that they're going to start sending signals that much sooner. And then the other end of that is your mind or your brain. Your brain's overall purpose is to keep you safe and keep you alive. So when it notices there's all these extra signals coming in, I think of it kind of like becomes a helicopter parent, and it wants to know what's going on, where is it going on, for how long, who with, is this bad, is this good? So some of the changes it makes also kind of further lower like the pain threshold. And normally your brain would, like, if there was something that, like a paper cut, it hurts for like a couple seconds, but then, a minute or two later, it doesn't hurt so bad. Part of that reason is your brain has sent down hormones to like dampen the pain level, because you're not going to get anything done if your paper cut hurts all day. But when you've had pain for a while, it kind of slows down, it like shuts down or slows down those chemicals it sends down. So not only is you're having more intense pain because your threshold is lower, but you're also not getting as much pain relieving juice, so to speak, coming from the brain. So both of those kind of act to create the perfect storm, unfortunately.
Okay, so it sounds like there are biological changes that are going on in the body.
Yes. And the thing is that they're not necessarily really structural changes. It's more like it's literally on like a cellular level, like how it's the chemical reactions along the membrane of the nerve cell, like literally. And so that also presents a challenge. And like there's no blood test, there's no x-ray, there's no MRI that's going to show you any of those changes. Which is why, you may go somewhere and they do your lab work, they do all the other stuff. Well, it looks fine.
Yeah.
Well, yeah, because it's not anything that shows up on imaging. And the other thing about the nervous system too is when it's doing all this, you're basically kind of stuck in a fight or flight state. And that has all kinds of other consequences in terms, like it can start to affect, your gut. It can start to affect like memory, brain fog, all kinds of, basically there's all kinds of other things that then happen to your body when you're stuck in fight or flight. So a lot of these things tend to be connected. And so if you kind of address nervous system issues, a lot of these other things start to subside. If that's the good and the bad of it, when you address it, some other things start to subside a little bit.
So what exactly can we do to address our nervous system then?
Yeah, a couple of things. So I usually, if I kind of talk about both of the regulating part and the reprogramming piece. So the regulating is more kind of addressing that fight or flight state and basically just trying to either move out of fight or flight, or just get the rest and digest, or the other half of the nervous system, to kick in a little bit more to kind of balance it out. Well, the most important thing, which is also quite challenging when you have pain, is sleep. It's kind of a revolving door of, like, you hurt, so you don't sleep well, so then you have more pain, so then you still don't sleep well. So it can be, and that it's just, life is just hard when you're not sleeping, let alone whether you have pain or not. So that is one of, like, sleep is trying to adjust sleep, I would say, is probably like the most important factor in trying to kind of help calm the nervous system. And so looking at sleep hygiene, there's a gajillion things, don't drink caffeine after blah, blah, blah. But in terms of what I have people focus on is, like, trying to go to bed at a fairly consistent time, and trying to develop maybe like a very short, like, bedtime routine ahead of that. Because, like I mentioned before, your brain wants to keep you alive and keep you safe. So it's always kind of scanning your environment to, like, check for potential dangers, wants to know if everything is safe. So if you get in the habit of going to bed about the same time, and maybe, like, listening to a certain song or something before you go to bed, that becomes familiar. Your brain recognizes, okay, this means that we are getting ready to go to sleep, so I don't have to be worried that anything bad is going to happen. So I can kind of start to settle down and wind down. So that's usually my, like, number one recommendation for people, is address sleep and start trying to get to bed at a fairly consistent time. And otherwise, there's a gajillion other ways. I mean, there's breathing exercises. There's exercise, and I would just say, Kevin, let me back that up. I wouldn't say exercise, I would say movement. You don't need to, you don't need to go running. You don't need to go do, high intensity exercise. If you move your body for like 10 minutes continuously at about 50% of your max heart rate, which when you look at it is really not that much, then your body kind of moves into endorphin releasing zone. So you don't have to do this, walk for an hour and a half or high intensity stuff, just like 10 minutes, 50% max heart rate, and you start releasing endorphins. So all that kind of falls under the regulating the nervous system. And then the reprogramming nervous system looks more at communication between the body and the brain, because part of all these changes is just that becomes a little bit fuzzy. And this is a little more tricky to do. It's all based on kind of research and, like, the principle of graded motor imagery. So that basically works on kind of retraining how your body communicates with itself. It is similar to, there's a new, a newer, like, thought of doing this coming out. It's PRT, pain reprocessing therapy. It's along the same lines, but not exactly the same. But it's basically different. It's almost kind of like brain games almost, that work at basically just sharpening the lines of communication between the body and the brain. And so when the brain has a better idea of what's going on in the body, it's less worried, and it's less, and it kind of desensitizes things a little bit.
So I have a question on the sleep when you're talking
Yes.
about regulation. So I'm pretty good at falling asleep. I go to bed pretty much at the same time. I don't necessarily have a routine. I guess I kind of do. I say a prayer before I go to bed every night. But my problem, like you kind of mentioned, is I don't sleep well because about every hour to hour and a half, I wake up because I'm in pain
Yeah.
and I have to move positions. So if I get better sleep hygiene and kind of more focus on doing some kind of meditation or some kind of routine, is that going to help me sleep better through the night?
Yes. I mean, yeah, I think if you would do, yeah, if you would add, yeah, like a meditation, or even, I think within like 3 reps of deep breathing, I think can kind of start to move you into kind of the, activate sympathetic nervous system kinds of things. But yeah, so kind of having a handful of those little tricks, of like when you wake up, to kind of then calm things back down and get you back to sleep. And then of
Okay.
course, don't have pain when you have an infant, because that would be, you have no, that's the challenge, I think, when like I'm lucky. I mean, my kids are older, so I've got a 12-year-old and a 15-year-old. But I remember the phase when my daughter, how old was she? She was 4. And my husband made the mistake of telling her that she could get up to go to the bathroom by herself in the middle of the night. Guess who she came and got every single time she wanted to go to the bathroom? And I tried to talk her into going to my husband's side, but she's like, "No, mommy, I love you." And I'm like, but when, I mean, there's some things, being a parent, especially of young children, can make it especially challenging. You do what you can do. I mean, you kind of do
Right.
the best you can, and that's when it's helpful to have a helpful partner too, who can kind of help navigate some of those things.
Yeah, it's really funny. My daughter's 10, and her entire life, whenever she wakes up in the morning or wakes up in the middle of the night, she always comes to wake me up.
Oh,
Never, ever my husband.
I know.
Never. It's always me.
And at that, I mean, so at that point in time, I remember like in our bedroom, I was on the farther side of the room, and she had to climb over the dog that was sleeping on the floor to get to me. And I told her, "You can wake daddy up." And she's like, "No." I'm like, "Well, why not?" "Because I love you." "Well, daddy loves you." "Well, I love you more."
Oh.
And I'm just like, okay. But yes, so it's a challenge no matter what, but when you're trying to take care of
Yeah.
other people at the same time, that adds a whole nother element to it.
No, for sure. That's why my podcast is called It Hurts to Mom,
Mhm.
because being a parent with chronic pain is a whole other level to having pain.
Yes. Yeah, because I think sometimes, I mean, you add in a little bit of I mean, there tends to be a lot of guilt. People with chronic pain either tend to feel like they're not pulling their own weight, or
Mhm.
maybe they're a little bit of a burden. And then you add like a young person who you're responsible for, and they want to be doing things. That's a whole nother level of kind of, maybe, I don't know if guilt is the right word. So I think there's definitely some extra like mindset work to be done when you're a parent, um, to not kind of let yourself spiral down into kind of that whole deal. And there's, I think, it's even extra challenging to kind of figure out your boundaries and figure out where you need help. Because if you, on one hand level, that like you have to take care of yourself in order to take care of other people, but to actually put that into place on a day-to-day basis, um, is a lot harder. And
Mhm.
it takes time and effort and energy at a time when you don't feel like you have any.
Right. So, what are maybe some of the most common obstacles you see with people who are trying to regulate or reprogram their nervous system?
I mean, I would say in terms of regulating, I mean, it's really like the knowledge base. I mean, you can go, there's, I would say there's a lot of information about, it may not be called regulating the nervous system, but you could Google regulating the nervous system, calming the nervous system, or like, fight or flight, and it would kind of give you a bunch of different um options. I think picking ones that actually have some scientific basis, and actually some like, and basically like proven results, Especially today in the Google, you can Google and all these, or you can go on TikTok and you're gonna see all these weird, wacky things that are like sound scientific, but really don't have any basis in science and don't really have any consistent or proven results, or sometimes even theories behind why they work. So in terms of regulating, I think there's so many options. Where do you start, and how do you know which ones are going to be the most helpful? And I mean, I would say, from my perspective, like I said, I focus on sleep. I focus on movement. Breathing is also a big one. The breath is like the link, basically almost like between the mind and the body. It is the one like automatic like function of your body that you can actually voluntarily control. So like if you're stressed, your breathing pattern changes. So if you can, voluntarily change your breathing pattern, you can actually then change kind of what's going on in your body. So breath is also very important. The other thing I focus on is play, because people need to have fun. And that's like honestly one of the first things that goes, either when you're a mother or when you have pain. It's like you're just trying to get through the day. Like, who cares if you're doing anything fun or enjoyable? But I think that's important. It's important, one, just to help you feel like you're a person and you're you, but it also has benefits to the nervous system, because when you look at laughter, you look at gratitude, you look at like when you're doing hobbies and things, that all releases hormones that calm your nervous system down. So I think that's another, but I think it's an obstacle, because people will either think that it's not important, or they'll like, well, I can't do this the way I used to, so I'm just not going to do it. And like, well, you can probably do part of it, or you can probably find something else that you might enjoy that you can do and have a little bit of fun.
Yeah. I'm all about modifying tasks. So,
but I also think, one of the other biggest obstacles too is just is believing that it can work. Our healthcare system is really good at fixing injuries. Like if you have a broken bone, if you have a torn ACL, like we can do surgery and we can fix those. We're really good at treating symptoms and really good at treating structures. But that's not the overarching issue when you've had pain for a while. So, but that's all you hear. You go and you get an x-ray and you're told, you have this and you have that, but that doesn't always equate to your symptoms. You can have, someone with an MRI that looks horrible and they really don't have a whole lot of pain. You can have someone with an MRI that looks pretty good and they can't get out of bed. But I think just everywhere you go, like that's just the thought process, is that like, this is a structure, this is a symptom, we should be able to fix it with surgery or like put a band-aid on it. And just kind of trying to get over that thought that it's like a specific structure that, that can easily be fixed. And that's something that we can't see, but so kind of making that leap of faith, kind of that it's not just about what it looks like on an x-ray, that there's other factors that are impacting it.
Yeah, and I bet that's a hard one, because people with chronic pain have often tried so many different things.
Yes. That, to be honest, that is the hardest. I'm like, I just wish you could be in my brain and know what I know and feel what I feel, because like I know that there is something else that is going to be helpful. But when you've been to all the different specialists, and when you've had surgeries, and when you've had injections, and when all these other things, and when you've had, like I had a client the other day who like, she went to a neurologist and he just like looked through a report, and first thing he said, without really asking her questions, is, you need to go see a psychiatrist. It's like, what? So when you've had those kind of providers, like the kind of the hope and trust are kind of the two, I think, most challenging factors, understandably so.
Right. What do you think the biggest piece of advice that you would have for people with chronic pain would be?
Oh, good question. I mean, overarching is don't give up hope. Um, Even though, and that's why, I mean, it's like people who aren't in pain have no idea the level of strength and resiliency and grit, whatever other words you want to call it, that people in pain have. Because it's hard enough going through a regular day when you don't have pain, and then you add all of this in. But again, and then the treatment that most people get that is either inadequate or dismissive oftentimes, that is probably the hardest thing to hold on to, but probably the most important, because that's what's going to kind of keep you going, and that's what's going to give you a chance at getting somewhere different than where you are now.
Mm, yeah, that's a hard one.
Yeah.
Because I mean, I remember I had, chronic migraines for literally 20 years, and I had seen almost 40 different kinds of specialists, herbalists, acupuncturists. I mean, you name it, I'd probably seen them. And it finally, took me going into a 4-week pain recovery center inpatient in the hospital and learning about how much emotions are connected to physical pain,
Yes.
and just and then starting Botox. And it took a lot to
Yeah.
finally sort of get them under control.
Yeah, it is. And it too, because emotions release certain hormones. Some hormones sensitize your nervous system, others calm it down. So yeah, like stress and anger and guilt and all of those are gonna basically kind of keep your nervous system going. And that's, I mean, I think that's maybe the other piece of advice is there is not one single thing. There's not one single pill. There's not one single breathing technique. There's not one single exercise that is going to get you long-term results. You have to address, like I said, you have to address the nervous system, but part of the nervous system, like we said, is emotions. If if you have certain emotions that keep coming out over and over and over again, even if you get the communication between the brain and the body better, you're going to have all these sensitizing hormones floating through your system that are kind of keeping you a little more sensitive. So you really kind of have to address it from all angles.
Yeah, no magic bullet here. It's just a lot of little things.
Unfortunately. One, that'd be great.
Yeah, if you come up with it, make sure to call me.
Yes, I will.
So where can we find out more information about you and about what you do?
Yes, so I am online on Instagram is probably the easiest. I am the Amy Toth, TheAmyToth on Instagram. And then I am also the chronic pain relief specialist on TikTok. Warning you in advance, I am not an excellent camera person. So, my videos are probably not the most stellar, but I think they are kind of entertaining. And then I do have a free guide that kind of talks about things you can do for pain relief on days when you don't want to get out of bed. So I will pass along that link because it's a little bit too long to spell out. But that should be, I think, that you can go there, and hopefully it will be helpful.
Yeah, that sounds awesome. I can't wait to go check that out myself. Make sure to subscribe to this podcast so you don't miss any health, parenting, or life advice. For my freebie, which is 30 ways to relieve pain without taking a pill, go to ithurtstomom.com/tips. If you have comments, suggestions, or want to be on this podcast, please email me at ithurtstomom@gmail.com. I wish everybody a blessed and pain-free day. Thanks for coming on, Amy.
Yes, thank you.
Right, bye.